I'm in therapy clinic today talking to a very interesting man behind Restylane. And I'm with Dr Minocha.
Hi.
Welcome to my Snapchat.
Hello.
And you are the global ambassador for Restylane, aren't you?
That's correct.
So we're going to have a little chat about what exactly Restylane is and what it does. So what exactly is Restylane?
So Restylane is essentially a fully reversible dermal filler that has been around for 20 years. And the reason I trust Restylane is that we've done 28 million treatments with this product worldwide, and there's lots of medical evidence to show how well it works.
So Restylane is a filler, isn't it? Not a Botox.
That's absolutely correct. Restylane is an HA, which stands for hyaluronic acid, based dermal filler, which is fully reversible. It's fully reversible. Botulinum toxin is a muscle relaxing injection. So the two work very differently, but work in synergy together on one patient.
So from the brochure, it looks like it's used to kind of ease crow's feet, tired eyes and frown lines.
That's right.
Could you go through a bit more about what it's used for?
So Restylane is basically used to correct age-related volume loss. We all start aging mainly from the mid-face and around the eyes. And what we can do is replace the body's natural HA with a synthetic substance. So this is a substance which is non-animal based, so the chance of getting an allergic reaction are incredibly small. It's a synthetic substance that's made in a laboratory to be biocompatible with the human body's natural HA. So we're just replacing what the body is losing at 1% a year from the age of 30. So what we're looking to do is just replace that. And we have a whole range of dermal fillers which are able to do that, and they vary in consistency and firmness in order to produce a whole range of effects, from treating fine lines and wrinkles to replacing volume. So the downturned mouth, the sad looking eyes, and loss of volume in the cheek. And this is done in a very natural, artistic way, so we make you look like the best version of yourself, rather than metamorphosizing into a caricature of yourself. And that's why it's important that the physician you see is very artistic.
So say if you had this procedure done and you're not that into it, is it reversible?
That's the beauty of Restylane. It is fully reversible. We can reverse it with something called Hyalase, which we can inject, and within hours the filler is completely dispersed. So if you are a little unhappy with the results, or there's been overfilling, we can reverse this.
And what exactly is Hyalase?
So Hyalase essentially is hyaluronidase, which is also present in the body, which naturally breaks down HA and also can break down the HA in the dermal filler, making this a very safe option for you in the right hands.
So the brochure obviously has men in this as well. Would you find a lot of men would get this done, or is it mainly women?
Look, my practice is mainly women, but increasingly men are also interested. Don't forget, we too suffer from age-related volume loss, okay? So we want to look the brighter, fresher version of ourselves. Obviously, you may be put off by some of the media images that we see when you mention things like fillers, but if it's done in an artistic way, we can really make you look like.
So when you say, they have the person administering it has to be quite artistic, do they have to go to special Restylane training?
Absolutely. Restylane offer a range of advanced training for their individual practitioners, which is why I'm here in Dublin with the Therapy Clinic, working with their physicians to instruct them the best way to assess a face, how best to place the product, and what kind of product to place and where. And that takes time and takes experience.
So I see there's something else, skin boosters. This is obviously a kind of different product for different areas of the body.
Absolutely. Restylane is quite unique in that it has a range of products in its portfolio, one of which is the Restylane Skin Boosters. So this allows you to actually treat different areas of the body, for example, the back of the hands. And these are the second most common area that are exposed to sun damage. So there's no point in having a face that looks bright and fresh. Your hands look a lot older, as for example, maybe your décolleté from sun damage, or the neck. And the skin boosters are ideal to treat all of these areas.
So it's about kind of matching it all up.
Absolutely, and improving the skin quality, the crepiness, the moisture and hydration in all of those areas.
So before I came in here, I was kind of reading, you've done, I guess, a study on sets of twins, and the whole thing was endorsed by Sharon Stone.
Correct.
Tell us a bit about that.
So yeah, I was very honoured to actually do some work with a series of twins. So I treated 8 sets of identical twins just to show how natural results we can produce. So the idea was to treat one of the identical twins but not the other, and just to show that just using dermal fillers alone, the kind of results we can produce. And the idea was that normally when we think about fillers, we think about all the negative images, the overfilling and things we
Botched
see
faces.
Yeah, botched faces. The idea was to reassure the public that actually when you do it in a very artistic way, you can produce very natural looking results. And Sharon Stone very kindly endorsed the work.
So if people want to have a look at these twins beside each other to see for themselves, what do you search?
Absolutely. The campaign was called Proof in Real Life, and you can search that online and see.
So this is the event here in Berlin.
Absolutely. So these are the twins, and you can see before and after photographs, treated twin,
I
untreated
see.
twin. This is Amy and Julie.
Okay.
Amy has had treatment, Julie hasn't. She just looks brighter and fresher. She looks a little bit more tired.
Okay.
But if you walk past her in the street, you wouldn't.
And these are 2 men.
Absolutely.
Which one is the Restylane?
This is the Restylane guy.
Okay.
That was interesting.
Well, thanks Emil for that chat. And I guess if people want to get in contact, they can contact Thérapie.
Absolutely. Yeah.
Thanks Emil.
Thank you.
Bye.
Bye-bye.